And we're back with News Talk tonight. We're joined by Capponi. She's from CABVI. And January is National Glaucoma Awareness Month, an important time to spread the word about the sight-stealing disease. And Tara, not only are you with CABVI, you also have glaucoma, correct?
Correct, yes.
So first of all, for those that may not have ever understood exactly what glaucoma is, why don't you give an explanation of what it is?
Sure. What I like to tell people basically in layman's terms, it's really almost like a bad plumbing in your eyes.
Mm-hmm.
The fluid that stays in your eyes that's supposed to normally just flow properly, it gets it builds up and causes pressure, and that pressure crushes the optic nerve, and that ultimately causes damage to the optic nerve, causing vision loss.
Gotcha. There is a simple test for glaucoma, which then leads us into our next phrase here, is that you should be getting, once you're an adult, even kids should be getting an annual eye exam from very early age, right up until you can't see anymore.
Correct. Well, that's just it. The myth is that it's an old person's disease, eye disease, and it is certainly not. I mean, I was diagnosed at 13 with juvenile open-angle glaucoma. It is hereditary, so I always needed glasses and contacts, so I was always taken to the eye doctor.
Sure.
However, some people think, well, I never needed contacts or glasses, so why would I ever go to get my eyes checked?
Yes.
Well, it's just good to get your eyes checked regardless, because even if you don't need contacts or glasses, you still may find other health issues going on through your eyes.
Yes.
So, and even if you don't, that's wonderful, but it's better to be safe than sorry.
So you have glaucoma.
Correct.
What is life like with it, and what can be done about it?
Life is pretty okay for the most part. I mean, I am on 3 different eye drops a day, and an oral medication. I have had 3 different surgeries. The laser was easy, but it doesn't seem to last as long as the really invasive glaucoma surgeries, and I had 1 invasive last year.
What kind of recovery time are we talking here?
The laser surgery, it could be just a day or 2. The invasive surgery I had was about 2 to 3 months, and I almost want to say, like, you'd never really want to get your script updated until like a good 3 to 6 months after.
Okay.
So.
Bottom line is go see your eye doctor as soon as possible, just to get a checkup. And again, the test is very easy. What is CABVI doing this month?
CABVI is just advocating, as we always do.
Sure.
So we have a low vision suite, and usually when someone has low vision, the doctor tries to sit with that person and get them to get as much out of their usable vision that they have left, so that they can see the best with that vision they have left. For example, I'm 40% blind in my left eye, so we will, instead of like going through the eye chart with it up against my face, he will use different tools and it's really more basic of an exam, and just look across and say, well, what is better this way, what's better that way, may add some reading glasses, may add just a lot of different things that are simple, but you wouldn't get at a quote-unquote normal eye exam.
And there are risk factors, by the way, and I want to put these up on the screen. One of the big ones is age and a history in your family as well. That's a big one. History of high eye pressure in your eyes.
Correct. So normal pressure in someone's eyes is between 12 and 22. So if you have anything 22 or higher, we don't diagnose glaucoma on pressure alone. There is a whole comprehensive exam.
Yeah, it's a big one.
So so you have to have the dilated eye exam, you have to take a visual field, the picture of the optic nerve needs to be done, the cornea thickness, but it's all really just, nothing hurts. It's not painful to have any of these tests done. It might take an extra 15 minutes, but it's so worth it, because if you are diagnosed, you can get treated immediately.
And the best way to prevent from getting glaucoma is get that eye exam.
Correct.
Tara, thank you so much for coming in.
Thank you.
You're looking good, and we're happy that you're doing well.
Happy New Year.
Happy New Year to you. More news coming up right after the break. Stay with us.